Hello, differential diagnosis students. This is Dr. Kamel again, and one of the NBT style questions, and this is question number 3. Let's go ahead and read the question together. A physical therapist reviews a patient's medical record and identifies that the patient was recently placed on a corticosteroid medication for the treatment of a medical condition. Which of the following conditions would most necessitate or warrant the use of this type of pharmacological agent? Is it dermatitis, folliculitis, melanoma, or rosacea? Rosacea. Okay, so this type of questions need the knowledge of both pharmacological agent and for the physical therapy license exam there are increasing number of questions related to pharmacology, and at the same time it needs your knowledge of pathology, what's meant by dermatitis, folliculitis, melanoma, or rosacea. So let's see, which one do you think is the correct answer? Why we are using corticosteroids, or why physicians prescribe corticosteroids for patients? Corticosteroids provides anti-inflammatory effect, hormonal effect, and metabolic effects. So three things: hormonal, anti-inflammatory, and metabolic effects. Okay. Corticosteroids reduce inflammation in conditions that can damage healthy tissues. How? Through a series of reactions. Vasoconstriction result from stabilizing lysosomal membranes and enhancing the effects of catecholamines. Okay, so mainly this like a hint about corticosteroids or the uses of corticosteroids. Let's go through the answers together. The answer for this question is number 1, dermatitis. Okay, so basically, what is dermatitis? Derm means skin. Okay, dermatology is a branch of medicine which is dealing with skin disorders, for example. So dermatitis is a broad term covering many different disorders characterized by a rash combined by pruritus and erythema, for example. Patients with dermatitis are often treated with corticosteroids, antihistaminics, or medications which modulate the immunity or for this patient, or immunomodulators. Okay. There are some actions also recommended to the patient, like including wearing loose fitting natural fiber clothing, avoiding wearing plated jewelry, and lubricating the skin after bathing. Okay, so this is a hint about dermatitis. Let's look about the other cases, or the incorrect answer. Folliculitis. What is folliculitis? Folliculitis is a common skin condition where the hair follicles become inflamed. So inflammation of the hair follicle, basically. Usually due to what? Due to bacterial or fungal infection. Okay. Patients with folliculitis are often treated with antiseptic medications or antibiotics. Actions to avoid folliculitis include what? Shaving with care, keeping the skin moist and well hydrated, and avoiding sanitary hot tubs and pools. Okay. Melanoma. Melanoma is a very dangerous skin cancer. Melanoma is a malignancy originating from connective tissue such as fat, cartilage, bone, or muscle. Patients with melanoma are often treated with surgery, chemotherapy, radiation therapy, or immunotherapy. Okay. Actions to avoid melanoma including what? Limiting ultraviolet radiation exposure to ultraviolet radiation, and examining the skin on a regular basis so melanoma can be discovered earlier. Rosacea or rosacea is an inflammatory skin disorder that causes facial erythema. Facial on the face, facial erythema. Patients with rosacea are often treated with antibiotics, vitamin A derivatives, or laser surgery. Actions to avoid rosacea including avoiding spicy and oily foods, reducing sun exposure, and limiting alcohol consumption. So we can go and see maybe together some of these disorders. So let's go. Okay. These are some pictures for rosacea. Okay. How about dermatitis? These are examples of dermatitis. How about melanoma? This example of melanoma, irregular borders and so on, and we will be talking about that when we are screening for skin disorders later on. So there are for melanoma what's called A, B, C, D, E. A, asymmetry, okay, B, borders, color, diameter, and evolving, and we might be talking later on about that. And how about folliculitis? Okay, so this is inflammation of hair follicles, which is a little bit nasty. Okay, and bacterial or fungal and so on. Okay, so this was the answer for today's question. I'm hoping to see you soon in another question. Thank you.